Hey everybody, this is Jason from Core Physical Therapy, and today I'm going to show you guys a little bit of cervical self-care. Today we're going to learn how to do a little bit of cervical traction as well as some self-mobilization and strengthening of the cervical spine. And this can be done anywhere, office chair, on your couch, or recliner. Now I have to mention that if you experience any pain during these techniques or have a history of trauma or severe neck pain, please do not attempt these and contact a medical provider. Okay, so the first technique is going to be the cervical self-traction. First, we need to find our contact points. What we're going to be using is the little bony part that's right here, kind of at the top of the wrist and at the base of your pinky. So if you kind of feel around in here, you'll find one little bony spot and you're going to come right off of that. That is going to be your contact point. Okay, and you're going to use that on both sides. The second contact point, where we're going to be pushing the head up just a little bit, is here on the cervical spine. So what you're going to do is you're going to come about almost 2 inches kind of behind the ear, straight back, and then what I want you to do is then drop down until you feel kind of a cliff. There's going to be a cliff right about here. Okay, so as you're pushing in, you're going to feel bone, 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 and then cliff. Your finger's just going to sink right in because it's just come off the back of the base of the skull. Okay, that is going to be our second contact point. All right, so to do the technique, you're going to take your wrists on both sides. You're going to do the same thing. You're going to just bring those bony parts down until you kind of drop off that cliff. And then if you push up like you're doing this, you should feel like it hits bone kind of on bone and your hands don't really slide, okay? Now it's important to mention when we start doing this, the objective is not to yank your head off, okay? Because that's going to create a lot more problems for a lot more medical providers. So what I'd like you guys to do is you're going to drop down, you're going to find that bony cliff where your bones just kind of sink in into the neck. You can then clasp your fingers kind of behind your head. In personal preference, I like something that reclines, chair, couch, office chair. And what you're going to do is just lean back and kind of just rest your head in your hands with those bony contact points. And again, you don't have to squeeze. And then what you're going to do is just gently press upwards on those 2 contact points while trying to keep your head relaxed. Relax those muscles. If you're doing it right, you're going to feel kind of a deeper stretch kind of down into this neighborhood. Okay? And once you're there, you can hang out here for as long as you'd like. There's no wrong answer. You just traction up and you can kind of relax. Great to do in front of the TV. More screen time. And then just hang out. Okay, the next technique that we're going to learn is a self-strengthening and a gentle self-mobilization technique of the cervical spine. Okay, so the basis of the technique here is that you're going to be using your hand as a resistance to cervical rotation. Okay, so what you're going to do is if you find the center, at your eyebrow, centered right above the eye, you're going to come up and maybe back just a little bit, so you're kind of like right here on the temple. Okay, now you can use 2 fingers, you can use 3 fingers, you can use your palm. My preference is palm. So from this position, what you're going to do is you're going to rotate to your right or left, and you're going to apply some resistance. Now the idea is to not stop you completely, but to give a little bit of resistance so you feel like you're working fairly hard, but not terribly hard. So what you're going to do, the first part of the technique, is you're going to turn to your right or left, giving yourself a little bit of resistance as you get to the right or left. And then once you're here, you're going to be pushing back with the hand, but slowing down with the neck. So the driver of you coming back to center is going to be the hand, but your neck and head are the ones that are going to be slowing it down. Pushing through resistance, and then gently resisting the turn. just like that. It's not uncommon to get little clicks or pops. Important point of the technique is to make sure you're not pushing into pain. You want to stay just below any sort of pain threshold, any sort of discomfort threshold. You should feel like you're just working, okay? And that will help strengthen those muscles, both right and left. And you can even do this side to side, same concept. You can even do kind of circles where you have a little nods kind of along the way. You don't even have to go through the full technique. Sometimes you can turn right and left and just feel like your muscles just kind of skip a little bit, like it just judders through. You can play with that because what you're doing is then you're really getting down to some of those muscles that are a little bit weak. So you can actually really pinpoint some of these really nicely. So if you're going through and you're getting about halfway back and all of a sudden you feel like it just kind of skips through, play with that a little bit. Just kind of go back and forth in just that little bit of range. And that'll help activate some of those muscles as well as get those muscles acting on the joints to help kind of loosen them up. So the last two techniques really looked at a little bit more of the upper cervical spine because most of your rotation is 45 degrees, and then obviously with the traction, you're getting more of that upper cervical spine. So how do we get lower? How do we activate some of those muscles on the lower cervical spine to get them working the way that we need to? So one technique I teach to patients are basically cervical extensions, but you're holding a chin tuck. So a lot of patients know the chin tuck. If you don't, the chin tuck is basically just retracting your head straight back, okay? So you're going to be holding that throughout the entirety of this technique, okay? So what you're going to do next is you're going to hold it, you're going to drop your head all the way down so it's on your sternum, okay? You're going to hold that chin tuck. Now you're not going to go very far in this position. And then I tell patients that you want to drag your chin up the front of your neck until you come back to a neutral position. Okay, so you're holding a chin tuck, you're going down, and you're coming up. Nice and slow. And to make this a little bit harder, because most patients don't really have a problem when they're sitting up, is to then you can either lean forward or you can go onto, on your hands if you're lying on the on a bed or on the ground. But by leaning forward, you're getting a little bit more of gravity. Coming back to that neutral position, and then back down, holding that chin tuck. Make sure you're not lifting up those shoulders. Want them relaxed. Up and down. To make it harder, you could do this lying over an exercise ball, or you can do it while you're on all fours. All right, everybody, I hope you guys found that helpful, and it gives you a little bit of relief. Like I said before, if there's any sort of pain or discomfort or any history, worrying history of trauma or rheumatoid arthritis or anything like that, please do not attempt any of those types of activities. If you're experiencing severe neck pain, please contact a medical provider and have that looked at before you start treatment. If you need anything from Core Physical Therapy, you can find us at www.coreptclinics.com. You can schedule in-person appointments as well as telehealth appointments to get a more personalized treatment plan for you. Be well, and we'll see you next time.